Hi guys, this is Dr. Abraham. I'm here with Bianca. Bianca.
Sorry, it's
I'm sorry. Sorry for butchering your name.
it's medical
You
assistant.
wanna-
Yeah, I'm out. Cut. Done with you.
What was it, Bianca?
That's it. That's my name.
And we're here at Valencia Medical Center for Live at 5. So, yeah, thanks for joining us.
We're talking about memory relapse and how to properly pronounce.
So, as usual, we're going to be answering some of your questions. If you guys have any live questions, send them to us, and we'll also talk about some of the stuff that we got through the DM. We had a few questions for last week. We weren't able to go online last week because we got a little backed up with the clients, so we have some questions from back then as well.
So our topic today, we are going to talk about PRP for sexual rejuvenation. We've had lots of people calling in asking questions. We've had lots of people emailing us or DMing us on Instagram. A few of the questions so far for men, the Prp Penile Shot. Can you explain what that is?
Sure. So the Prp Penile Shot is basically PRP in general. I guess I'll just clear that at the beginning because it seems like we're going to be talking a lot about it. PRP is when we take your own blood and then we concentrate the platelet-rich plasma, which is what PRP stands for, and we use that for treatment. And there's a few different treatments that can be done using the PRP. And obviously the way we might process it might be a little bit different depending on what treatment we're doing. But the gist of it, the principle of it is that we're concentrating that platelet-rich plasma from your blood and then we're using it for treatment. And in the case of the penile shot, we're injecting it in the penis, and men are doing that because because of its potential benefits with sexual function. So it can help with people who are having issues with erections, whether it's maintaining an erection for a long enough time or suffering from other similar sexual function issues. The PRP can be a great treatment for many of these people. Simple treatment, we usually numb the penis obviously, and it's a few shots and it's done, and kind of the PRP starts doing its magic. And
Do you think that this is the best option for erectile dysfunction for men?
I mean, it's a great option. There is no best option for everybody because everybody's going to be a little bit different. That's kind of one of the things that we do here, and we always try to do with all our patients is figure out what the what's going on specifically with that patient, what the context is, and then see which treatment option is best for them. So PRP is a great option for many people. It is the best option for many people, but it can be combined with other stuff. It can be combined with medications, which some people are already on, but obviously many people try to do PRP or other treatments if they're trying to get off their medications or for other concerns. There are things that we do here along with the PRP, sometimes like acoustic wave therapy, shockwave therapy, and hormone replacement therapy. If someone's testosterone is very low, then replacing the testosterone can definitely be very beneficial. So it's really the best treatment is going to be whatever is best for that patient. Sometimes it's PRP, sometimes it's hormone therapy, sometimes it's something else, and many times it's a combination of more than one thing. So.
Okay, how would you describe to your patient if they're a good candidate for the penile shot? Like, how do you determine that as opposed to doing the acoustic wave or the bioidentical? Is there one or the other?
Yeah. So, I mean, in terms of safety, that's one of the great things about PRP. It's honestly safe for most people. There are a few exceptions here and there, but generally speaking, any healthy adult who doesn't have any major concerns or major medical issues, they're going to be okay with the PRP because unlike many other treatments, we're not we're using the patient's own blood, so we're not really introducing like a foreign substance to the patient, so it's relatively safe to everybody. Now, depending on what that patient's issue again is, and sometimes you might want to do like hormone levels to make sure that it's not that their testosterone is extremely low that's causing the dysfunction, for example. So generally speaking, the first thing we want to establish is that it's safe for that client, and again, for most clients, it does tend to be a safe option. But then we can see where the client is in terms of their, whatever sexual dysfunction or whatever symptoms they're experiencing, and what's the likelihood that PRP would be helpful in that regard. So, many times someone, especially when their hormones are controlled, and they just want, stronger erections, and they want to be able to last a little bit longer or restore some of the sensations that's lost with time, unfortunately. Many of these candidates many of these clients end up being great candidates for PRP.
Okay, I know you mentioned that you do numbing on the penis. Aside from that, does it hurt? Do the injections hurt?
Honestly, surprisingly, not. No, it doesn't. It would hurt if there was no numbing, then it would be very painful. But the lidocaine takes care of it. So usually it's kind of the initial shot, which is really not it's at the base of the penis is where we put the lidocaine. So it's initially that first poke that's more of the lidocaine that people feel. But once kind of the lidocaine kicks in within a few minutes, most patients don't feel anything.
Okay, and if a patient is actually taking medication for erectile dysfunction, does it have a negative effect on the PRP or a negative effect on...
No, generally speaking, as I was mentioning before, because we're using your own blood, we're not really introducing a new medication that might have interactions with medication that you're already on. So there is no contraindications, generally speaking, over there. Again, we still would want to review every patient's medication and kind of make an individual decision. But no, there's no issues. Most patients can continue on their medications. Oftentimes, people are doing it because they're trying to reduce the amount of medication they're taking, and so over time, they often do kind of decrease maybe the dosage, but it's not a contraindication.
Okay, and then someone also asked, how long does it take for the PRP shot to work? Like, do you notice results right away? Does it take a couple of weeks for a man to notice once they get the...
Yeah, most people, it's going to be a couple of weeks before they start noticing anything. There's definitely, we have some people who, like, the people who respond kind of best, they see results right away, or within, within a few days. Mm-hmm. We often get calls of people who within a few days have seen like a great result and they're happy. But that's, those are the people who are like kind of the best responder. But for most people, it's going to be a few weeks before it really kicks in. But the good thing about it is with PRP, like many other PRP treatments, you're going to be seeing improved benefit over time. It's going to continue over the next few weeks and months. So, even if you see just like 10, 15, 20% improvement within a few weeks, that's usually a very good sign, because you might get another 10, 15%, in another few weeks, and then another, like, let's say 10, 15% a few weeks after that. So it just kind of adds up over time.
All right. So as we're talking about PRP for sexual rejuvenation, let's move into the shot for women. So It's the Prp Vaginal Shot. If you can explain what it is and why would people get the PRP, or women get the Prp Vaginal Shot?
Yeah, so it's a very similar concept, and it's something that can be used, for males, as we discussed. It can also be used for females. We have a lot of female clients who are coming in just because they're looking for just more enhanced, sexual activities. So, whether it's better lubrication, better sensations. These are probably two of the most common things that we've seen people come in for, and it's one of these things where the word of mouth have been like very helpful, because then they go back and they experience it, and then they kind of start telling their friends that their sexual lives have improved, after the shot, and then the friends come in. So it's for the same thing, and it's kind of, I guess, something that maybe I didn't explicitly say when we were talking about the men's shot, but it's not something that where you have to have, like a complete inability to perform sexually before you get it, like a incomplete inability to even have an erection to kind of come and do the PRP shot. In fact, many times, if it's too late, the PRP shot might not do much in that case. But it's great even for someone who's able to, have their sexual activity, but they just also want to enhance it, and they want to improve things.
Okay. Is there any side effects, or is the shot safe for women?
Yeah, pretty safe. The fact that it's your own blood, that's not a foreign object, it really kind of takes care of a lot of the potential side effects that we see with many other medications.
Mm-hmm.
So you're not gonna like get an allergic reaction for it. For example, it's not gonna interact with other medications. It's pretty localized. It's not gonna affect you systematic. It's not gonna go systemic. For example, whenever we do an injection, there's obviously like certain risks still, like bruising, bleeding. There's possibility of an infection. I don't think we've ever had anything other than like maybe some bruising in our clinic, which is common, and bruising goes away in a few days.
Sure.
But there's always like a risk of infection and other stuff. But we really use, we're pretty sterile as much as possible in our office, which really kind of minimizes that risk. And I've never had experienced that.
And is the numbing the same process for women, or is it more of a topical, or still an injection? Like, how does it work for women versus?
It's similar. There's a couple ways to approach it. We've seen a lot of benefit with kind of doing more topical first, and then a couple like injections if needed of lidocaine. So
Okay.
yeah.
All right. How many treatments do you think someone would need for maximum results for both men and women, I suppose?
Honestly, a lot of people just do the one treatment and they're happy there. But if you want it to get a little bit more, you can do more than one. It's very safe again, so you can definitely do more than one. Most people will do the first treatment and then we'll follow up with them in a couple months, 2-3 months, and we'll either, they're very happy with the one treatment and we stop there, or so they might stop at the one treatment, or if it's something else, maybe they'll be like, okay, I like it, I do want to get another treatment just because I saw 70% improvement and I want to try to get a little bit more. So usually one, sometimes two.
Okay.
After that, maybe once a year kind of maintenance treatment might be appropriate.
Okay. And then as far as being a good candidate for the PRP vaginal shot, how do you determine that as well? I mean, I know you kind of touched a little bit on it, but if you can go into more detail about it.
No, very similar to males. I mean, most people, barring a few exceptions, are going to be, great candidates for it. There's some obvious contraindications. For example, if someone's like pregnant or something like that, and we obviously try to avoid these kind of procedures. Somebody who's healthy, who doesn't have any, blood diseases or anything like that, they tend to, be great candidates. And someone who's honestly looking just for kind of improved sexual performance, and they've been, been interested in the PRP. Maybe they've tried some other treatments, and they just want to try something different.
Okay.
Yeah.
And then I think you touched on this as well. Somebody was asking what results can they experience after the procedure? So more or less enhanced sexual experience type thing?
Pretty much. That's kind of what we hear most from our patients. The two things that we've been hearing a lot are, improved lubrication, but also just improved sensation, and it just, just improved sensation. Like the experience, I guess, is more pleasurable all in all. The orgasms are a little bit more intense sometimes with many clients. So, yeah, it's just an overall better experience, I guess, for both males and females.
Okay, I think that's it. That seems to be all the questions that we have.
All right, sounds good. Well, thank you guys for joining us. Hopefully that was somewhat helpful. And if you have any more specific questions, send us a DM, and we'll see you next time. Bye.
Bye.